I'm Dr. MaryKate. I'm a physical therapist here at Thompson Healthcare and Sports Medicine, and today is going to be the first part in following Becky's journey. So she originally had an injury about a year ago to her left knee, some LCL and ligament issues, didn't have surgery, and then about a month and a half ago she was playing soccer and went to change positions and ended up tearing her ACL. So right now she's actually doing prehab prior to getting her knee surgery. So we're gonna go over some of the exercises and some of the stuff we do while she's in PT now. So a lot of times when patients have these kinds of injuries, they lose range of motion from their affected leg in comparison to their unaffected leg. Becky was lucky that she doesn't really have too much of that. So a lot of our rehab has been focused on trying to give her more of that strength and stability in the leg, so that way she doesn't lose as much and has more muscle atrophy after the fact. So one of the things we do during manual therapy is what we call a PNF pattern. So I just provide manual resistance to her leg throughout patterns. So the first one we're gonna have Becky do, she's gonna keep this knee nice and straight, push her foot up into me here, and it's gonna be almost like she's coming out to kick me. So go ahead, Becky. Good, and relax down. And again, good, and again, good. One more on this side, good, and relax. And the other one we do, so again, she's really trying to keep this knee as straight as possible, and now we're just gonna be coming up towards her opposite knee here. So when you're ready, Becky, go ahead, up, good, and relax. Go ahead again, good. Two more, good. Last one. Good, and relax. Another table exercise that we utilize a lot is a clamshell. So the purpose of this is to really work her glute medius right here, which is very important for stability in the knee. So we made it a little bit harder for Becky since she's a former athlete. We have her go up into a side plank to get the core engaged more, and then go ahead and lift this, and then hold. So now she's holding here and now utilizing her core to maintain this position for about 30 seconds, and then we'll do about 3 sets on each side. So one of the exercises we have Becky doing is a bridge, but to make it a little bit more specific to her injury, we have her doing it with a 4-step walkout and a 2-step back in. That improves some of the recruitment coming from the hamstring, so right back here in her leg, just so that way we have it as strong as possible. So Becky, if you don't mind, so she's gonna flatten her stomach, squeeze her butt, hold this position, and go ahead and walk out. Good, and then 2 back in. And then she resets, just to make sure she engages her core, engages her glutes, and then we would do a couple more repetitions before taking a break. So one of the last exercises that we have Becky doing is what we call hip patterns. So this is a great exercise because you're working both legs at the same time. So the first one we're gonna have Becky do, she's gonna let her leg come towards the machine, think about squeezing her glute and bringing the foot back. So while she's doing that, this standing leg has to work to keep her stable and not let her move all over the place. So we do this in 4 different directions. So we'll do this direction, then we'll come this way, she brings the leg towards the machine, and then in front of her opposite foot. This is gonna work these muscles right through here, while this leg is still working to keep her stable. Go ahead and face forward. Then this one, she's just gonna kick straight out. So this is gonna really focus on utilizing our hip flexors. And then last one, she'll be facing me. And then bringing the leg out to the side. Good. And again, she's really focusing on that glute medius that we talked about earlier and really strengthening this up to give her some of that stability throughout her leg. Good job, Becky. So Becky's going in for her surgery really soon. Check back and follow us because we're gonna be going month by month with her ACL journey in recovery and hopefully getting back to soccer.